Hi everyone, this is Dr. Khan, Executive Plastic Surgery. So we have an interesting Facebook Live, YouTube Live. So this is a nice patient from Austin, Texas with a set of implants that she got in 2012 below the muscle that when it only set. And she said that she had what are Saline implants. And so she comes in with the symptoms of what are, suggestive of what is DrSk&x illness. And a typical history and workup was done. And so here she is. So complete end block, A2125 initial skin. I got my sterile gloves. I cut out the excess skin, as you can see. The incision relatively small. I removed some of this tissue on the side that was inflamed, angry, irritated, and I'm going to send this off with a capsule. And you will see complete total capsule removal. Now, just by touching it, as you will see, this has what are all suggestions and consistencies with what is a silicone implant, not saline. So as I go in here, remember this is a 13-year-old set. Could it be ruptured? We're going to find out soon. And we have no idea what is on the inside. And so this is the whole reason for the end block. We do not know what's on the inside. We do not want to find out during the surgery. You can see how thin the capsule is. You can see my scissor as it goes underneath. No matter how thin the capsule, the entire implant and the capsule has to be removed. You can see the capsule spread intact silicone implant, not saline. And overall, I'm very happy with how the whole dissection has gone. This is your Allergan 330. And so if I go like this, you will see the stickiness. This is consistent with that leaching. You can see that is so. You can see the stickiness. This is the leaching of the silicone. So Allergan 330 style 10 intact implant, and you will see the capsular tissue so thin. You can see my glove underneath. Some areas thicker. If I turn this around, this tissue all is inflamed, angry, irritated. All of that has been removed. And so I'm going to go ahead and put the capsule here. I couldn't be happier with how the whole surgery went. So I'm going to remove my top glove, and we're going to work on the left side with my sterile glove, because remember, I'm going to take cultures in between. I'm going to take cultures of the inside right here to get a representative biofilm. So left side and block, the gold standard. And you can see what appears to be a contracture band right here. You can see, look at the band going like this, and it's brought this together. This is kind of putting pressure. And this is, again, the entire implant capsule. And as you will see, this is part of where the rib dissection was. So that ensures that I'm not going to cut into the capsule, and complete total capsulectomy is thus done. So I'm going to go in from here. I want to mention, this is the Khan procedure. No drains. Look, she's 39 with the implants removed and the excess skin, between the recoiling of the skin, between the fluffing effect, between the implant gone, and now the breast itself has had a chance to expand. Just the proximity of the implant to the breast tissue will cause the breast tissue to atrophy. Between the pseudo lift, the excess skin removed, the internal sutures that I put, the 30% or so of the skin and the breast tissue that's going to retract, she will clearly not be a candidate for a lift. And this is number 2. Number 3, the capsules will be going to pathology. Number 4, microbiology, aerobic, anaerobic, and fungal cultures. So I'm going to go ahead and take cultures of this inside that I'm going to send to microbiology for aerobic, anaerobic, and fungal, so I can get a good representative biofilm. Implants will be returned to the patient, so she will know that she got silicone implants when she first got them, and not saline like she had written down in the intake form. The high definition pictures and videos of the chest wall. This is the most important part of the whole thing, the chest wall pictures that show complete removal of the capsule. Plus this video is good enough, but if you ask me as an explant specialist, the chest wall high definition pictures and videos are key. That ultimately proves that the surgery was done. And then this cutting open of the capsule on the table that you're seeing, the deep sedation twilight, the patient's not paralyzed, and so I like this. The patient's able to recover, and this is very efficient anesthesia. To date, not a single patient has woken up. And then all patients, regardless of their comorbidities, underlying problems, they get the same surgery, like this patient or the patient that I've done last week, last month, last year, 5 years ago. We do not compromise this. Now, there are lifts that I've done in patient. Yesterday, I did a case where the patient came in just 2 days ago with what is an infected right breast implant that just started. And so she came to me as a first consult on Monday, and I told her we need to go for surgery. I ended up doing the surgery, so I ended up placing 2 Penrose drains for the abscess. And so the bottom line here is there are certain variations, but this is pretty much consistently followed in situations like this. So now what I'm going to do is I'm going to go ahead and cut open this. I want to show this contracture band. Remember, I have no idea if this is going to be ruptured or not. I can tell by the consistency. If I hit it, it's not like a waterbed feeling, if you will. So I know this is a silicone implant. So this is also intact. So it's very good for her. And so what I want to do is, you see that it's a little bit more evident. That's your stickiness. 330 Elegant style 10 intact silicone implant. I would say with brand new condition. Look at how thin the capsule is right here. If I put my glove, all capsule removed completely, sincerely, definitively, and wholeheartedly. And so if you ask me, the implants will be returned to the patient. Like I said, Capsule, city-centric pathology, cultures for aerobic, anaerobic, and fungal. No lift, no drain, twilight insulation, high definition pictures, videos of the chest wall, the most important, and this. And overall, I'm very happy and content with living with a lot less than 5 cc's on the right and for less than 5 cc's on the left, and I couldn't be happier with how the whole surgery went. This is Dr. Khan, Executive Plastic Surgery.